Brought to you by CGTN Europe.
Welcome to The Agenda. I'm Stephen Cole. The opioid crisis has taken on epidemic proportions across Europe and North America as thousands of patients and their families suffer financial ruin, terrible addiction, and sometimes death. It's been called the greatest drug crisis in human history. In order to get insight and perspective on the rise of this lethal addiction, I spoke to Ruth Dreifuss, a former president of Switzerland and now chair of the Global Commission on Drugs Policy.
It is very clear that this was the beginning of the epidemic. The overprescription of opiates was the driver, I would say, of this crisis now. It is clear that not all people who received the prescription also used this medicine, but this medicine entered also in another circle of relationship, for instance, to parents or to health or in the black market. But at the beginning, there was really an overflowing of medicine in a country where I would say the control and the liberal way of doing allows pharmaceutical to make publicity, to make advertising, to make also a certain pressure of the doctors, the physician to prescribe. That was the beginning.
When you were president of Switzerland, did you recognize this opiates problem? And if so, what action did you take to make Switzerland a safer place?
The solution we experienced can also be very useful now because there are solutions on one side of harm reduction measures. That means that we give the people the possibility and the services they need to consume in a less harmful way. It was also a great campaign of prevention, of information. Drug checking can help because the people generally, when they buy on the black market, because they have no longer access to the prescription drugs, medicines, they went because they are in pain, because they were addict to the pain relief medicine, they went to the black market. So they found the same kind of problems, and we can offer the same kind of solution. Safe injection room, drug checking to allow them also to know what they bought on the black market, to identify also the presence of fentanyl, naloxone, that is the medicine that allows to reverse the effect of opiate toxication. So this solution are also the solution needed now in North America.
Is it fair to say that many doctors were complicit? They were part of the problem because they were over-prescribing opiates without warning their patients perhaps of the dangers of overuse of opiates?
There were a lot of complices. The pharmaceutical industry, the big market that was also selling this, and the doctors who were over-prescribing. And the people who are the victim of this generally are victim in socioeconomic conditions that brought them, and health condition and poor health services that brought them to ask for pain relief, and after receiving opiates, they became dependent on it.
Is the ultimate answer, do you think, to end the criminalization and the incarceration of opiate addicts?
Well, that is absolutely clear for all consumers, drug consumers. Criminalization is just a wrong answer. This brings people to be marginalized, to lose more opportunity than they have in a reduced way perhaps now. It is a stigma for life. It is really the way, I would say, to put the heads of the people under the water instead of helping them and save their lives. What we need is really to find a way to regulate both in the middle, on a middle way, where the state takes responsibility for controlling the substances that might be dangerous for people, as they do, for instance, for chemicals in many countries. We have a good experience that regulating a substance is far better than just banning it or let the free market decide how to make money with it.
We may be some way behind the US, but here in the UK, the latest figures suggest that 5 million people are prescribed opioids every year, and 500,000 people are now hooked. The British Health Secretary Matt Hancock described those numbers as truly shocking. But how do people become addicted? I spoke to a former prescription opioid addict, now an admissions coordinator at UK addiction treatment centres, Nicki Hari, about how her addiction began.
Started from when I was having problems with my knees, and in the end I had surgery, and from the surgery I was then put on painkillers. So I was put on quite strong opioids, and I never got hooked on them straight away, and I have to say at the time the hospital was quite rigid in what they sent you home with, but it wasn't until sort of early 20s when I was still experiencing knee problems, and I went to the GP with quite acute pain, and I was put on strong painkillers then.
Escalating to what? You still had problems with your knees, but you didn't have pain?
I never actually realised at the time I was becoming reliant on this medication. So I was on...
Even though you didn't have pain?
Well, when I stopped taking them, I did have excruciating pain. What I didn't realise at the time was that was an opioid withdrawal, the same as a heroin withdrawal. Eventually I was manipulating the GPs, and I'd say, I've lost my prescription or I'm going away, I need more to top me up. There was one time when my GP said, that I think this is getting out of hand. We need to look at tapering you off. And I was so scared about that I moved doctors, surgery in the end.
How are you coping? You were married, you had children?
I wasn't coping at all, in reality. I thought I was, but my friends and family saw a much bigger picture. I was very depressed, I was isolating, I wasn't doing anything with my children, I was quite inactive. And I think the wake-up call for me was when, at the time, my 8-year-old son returned to school from the summer. And, they have to write about what they've done. He said, Mummy wasn't well all summer, so I stayed at home and played on my Xbox and in the garden. And at that point, I thought, what's going on here? And I was trying to analyse it, but I just didn't know what was wrong with me because I didn't see myself as a drug addict. I was taking what the doctors had told me to take. The only pain I had was the pain of withdrawal. So you get flu-like symptoms, you get night sweats, your legs are aching, your bones are aching. You're just shaking, you're sweating, you're depressed, you're crying. It's a whole snowball effect of withdrawals, of not taking what your body actually chemically needs now.
And are you clean now?
Yes, it was 8 years last week. So, yes.
Congratulations.
Thank you. And that was through, my friends and family staging an intervention where it was one day I was meant to be at the children's school it was sports day, and I didn't turn up. I just couldn't get out of bed. And I was taken to rehab to see a psychiatrist, and he said, you're a full-blown addict. And I was like, no, I'm not. I take painkillers, that's not an addiction. And he said, well, what if I take them away from you? And the fear that I had inside me when he said that, I knew that something had to be done.
And that brings us to the end of another edition of The Agenda. Remember to like and subscribe to iTunes, Stitcher and Spotify, and leave a review wherever you get your podcasts. The Agenda with Stephen Cole airs every Saturday on CGTN.com. If you enjoyed today's episode, remember to listen to more quality content at europe.cgtn.com.
The most interesting questions.
Are there other living beings beyond Earth?
Will man or machine be in charge?
Great question.
Always have more than one answer.
Well, hold on, let me just draw up a list.
And always come from more than one person.
That's where the credibility lies.
The concept of having a machinery which is alive and evolving didn't wait for us.
The end of inequality of incomes and wealth around the world, can you imagine how difficult that is at the moment to achieve?
Every episode, Stephen Cole, Murray Beveridge, and some of the brightest minds out there shed light on the answers to some of the most intriguing questions.
There are two ways of looking at this.
Machines can't really discriminate between civilian and military targets.
The Answers Project.
Maybe we need to just look at this in a bit more detail.
Extraordinary claims require extraordinary evidence.
The Answers Project, a new podcast from CGTN Europe.